Why is your pelvic floor so important during pregnancy? Well, your pelvic floor muscles are the muscles that fill your pelvis, and they're really important for many different functions, and they play an important role during pregnancy. I want to teach you about that role in this video. My name's Krista Norwick. I'm a pelvic physiotherapist, so I have a degree in physical therapy, and I have extensive training in pelvic health, including pregnancy and postpartum care. Okay, so what are your pelvic floor muscles? They are in your pelvis. So here's my model of the pelvis here. This is the pubic bone, and then your lower back, sacrum, tailbone, and your pelvic floor muscles fill the whole of this pelvis. So they're here, and your genitalia are here, vaginal opening, anus. That's your pelvic floor. Why are these so important during pregnancy? Well, as you move through pregnancy, your body is going through a lot of changes. Your hormones are changing, which can impact how your muscles are working. And also you're growing a human or potentially multiple humans in this region. And so as those humans grow, you're actually putting a little bit more weight and pressure down into your pelvis. And one of the major functions of these muscles is that they support your pelvic organs and your body weight, and they help with balance and core stability. And so as the demands change, so as your body is changing, as there's a bit more weight down into the area, your pelvic floor muscles need to do more in order to keep doing that job for you. So they need to be able to change and adapt throughout pregnancy. So it's important that they continue to strengthen as you move through pregnancy. It's also important that they are able to relax when you don't need to use them. So if you're walking around, you go for a walk, you're doing the dishes, whatever you might be doing, those pelvic floor muscles need to be working, and they need to be strong enough in order to support your organs. But when you sit down, you watch some videos on YouTube, you watch TV, whatever it might be, your pelvic floor muscles should completely relax. So you need those muscles to be engaged and strong enough when you're doing things up on your feet, and then they need to be relaxed when you're resting. And sometimes the ability for them to do that, sometimes it just happens naturally and you don't even notice them. But then sometimes they need a little bit of coaxing or a little bit of support along the way. So the best way that you can support your pelvic floor muscles as they change throughout pregnancy is to work with a pelvic physiotherapist. So there's multiple names for us: pelvic physiotherapist, pelvic floor physiotherapist, pelvic health physiotherapist, or if you're in a country that uses physical therapy instead of physiotherapy as the word, it would be physical therapist. We can help you determine if your pelvic floor muscles need a little bit of strengthening, if you need to learn how to relax them better. There's multiple different things that we could support you with in terms of your pelvic floor muscles. The other reason your pelvic floor muscles are so important during pregnancy is, especially near the end, you're gearing up for labor and delivery. You may have a vaginal delivery, or you may have a cesarean section delivery. If you have a vaginal delivery, your pelvic floor muscles need to be able to stretch. So this is the vaginal opening. Your muscles need to be able to stretch to accommodate for baby to come through your birth canal. If you have a cesarean section, the incision is right here. And so although your pelvic floor muscles don't need to be able to stretch out, because there's a surgery in the area, oftentimes your pelvic floor muscles are going to respond to that surgery. It's more common that they're going to tighten in response, almost like a protective mechanism, like, okay, I'm going to tighten and support the area. And so regardless of how you deliver, your pelvic floor muscles are involved, and they might change, well, they will change a little bit. And then after delivery is when your pelvic floor muscles recover. So they recover from pregnancy. They change throughout pregnancy to accommodate for the changes in your body. But then they also had changes occur during labor and delivery. And so during your postpartum period is when they're recovering, they're healing, they're going to adapt back to not being pregnant. And so this process, of course, is a lot for the muscles to go through, but it's incredibly amazing how well your pelvic floor muscles adapt and how well they heal. For some folks, you might find that you don't even notice your pelvic floor and it just heals and you don't notice any symptoms. For a lot of people, though, you do need a little help and support in that healing and in that rehabilitation of your muscles. And again, the great news is that pelvic physiotherapists are exactly the right people to help you with that recovery for your pelvic floor muscles. So what we can do is we can assess them and give you the exact exercises you need and support you in that healing and that recovery. You might need to do Kegels, but you might not. You might need to actually do relaxation exercises and allow your muscles to relax again. We often will also give exercises to regain the elasticity of the tissues after delivery, and we can help if there's any scar tissue or if you had any stitches in any region. So whether it be your C-section or in your perineal area, we can help you recover those too. So your pelvic floor muscles play a huge role during pregnancy, labor, and delivery, and then they need to recover postpartum. And we love helping you with that recovery. It is something you don't need to go through on your own. I've worked with people for sometimes over a year after delivery just because that's what they needed. And sometimes I only see people a couple times. Everyone is very different. It'll depend on so many factors, but you're not alone in it. There's this entire field of physiotherapy that has been developed exactly to help you with this. So we love helping you with it. If you're experiencing any changes in your symptoms in the area, bladder, bowel, or sexual function, we help with that. Ideally, you would see a pelvic physiotherapist even if you aren't feeling changes in those functions, but definitely if you are, reach out. We would love to help support you. You can see us online. Visit the link in the description of this video to book with one of us. And if you learned something in this video, it would be great if you could give us a thumbs up and consider subscribing because I talk lots about pelvic health topics and pregnancy and postpartum. All right, take care.